Good afternoon, everyone, and welcome to this Friday Special Edition Human Rights Day webinar hosted by Regent Business School. I'm your host, Dr. Navisha Parag, and I would like to extend a warm welcome to our esteemed guests, Mrs. Ravana Babalal and Dr. Nitin Gela.
Thank you so much for having us. It's such an honor to be a part of the institution.
It's been a great honor to attend this, to speak in this forum. And this topic of human rights is very close to my heart.
Thank you both very much. Some quick housekeeping for the guests. Please use the chat function for any questions or comments to be addressed at the end. And to all our healthcare colleagues, an ethics CPD point is allocated, provided you stay the duration of the webinar. Ravana is a specialist bioethicist, forensic medicine and medical legal practitioner who played a pivotal role alongside medical practitioners during the pandemic. She also has a keen interest in abstruse medical issues like palliation and persistent vegetative states, authored work on physician-assisted suicide, and is the director of her own legal practice. Ravana has graced various prominent public platforms and medical institutions by delivering academic briefings on medical, legal, and ethics content, expert interviews in media, and she is pursuing a PhD in public health and forensic medicine. Dr. Gela Nitin is a specialist physician and subspecialist gastroenterologist in private practice for over 25 years with diverse healthcare interests, including critical care, renal medicine, and first-hand front-line experience during COVID-19. He was involved in numerous COVID-19 task forces and steering committees and sits on multiple professional societies and panels. Thank you both so much for joining us today. Colleagues, as we commemorate Human Rights Day on the 21st of March, let us reflect on the past 2 years, where already commitment to upholding human rights has been faltering for several years in South Africa, and the COVID-19 pandemic has seemingly accelerated the erosion of our democratic fabric in our society, on which protection of human rights ultimately depends. The pandemic has upended our lives in so many ways and provided governments with an ideal pretext to perhaps exploit fears and restrict people's rights and pass emergency legislation that risks having long-term consequences beyond the health crisis. Please note that the discussions, the debate, and opinions shared on this platform are not necessarily those of Regent Business School. Without further ado, let us get straight into this discussion as we have quite a long hour ahead of us. By looking at the impact of COVID-19 in relation to the Bill of Rights in South Africa, Nitin, we know that human behavior fuels pandemics. Can you tell us a bit more about the history of human rights and pandemics? Nitin, if you can just unmute your microphone.
Sorry about that.
Thank you.
Thank you very much. Firstly, the relationship between the guarantees of human rights and the provision of public health is complex and is characterized by tensions between the state's obligations that are often framed as incompatible or mutually exclusive. The COVID-19 pandemic has brought this tension to the forefront once again since the emergence of the HIV pandemic in the 1980s. It offers us an opportunity to understand how this relationship has evolved during the contemporary pandemic. Since the 1829 cholera pandemic and the resulting missions to investigate the pandemics, many public health interventions were implemented without any regard for human rights and public health objectives were prioritized at any cost. However, the creation of the right to health through various documents and forums, such as the Universal Declaration of Human Rights and the World Health Organization Constitution, initiated a clear shift towards greater consideration of human rights within the public health space. The most profound shift in the relationship between the public health and human rights came with the adoption of instruments such as the Hdcsa principles and the Declaration of Alma-Ata, which place human rights at the forefront of public health responses. This webinar basically will utilize the lens as through which to analyze the approach to human rights and public health adopted by South Africa in the COVID-19 pandemic, where we discuss the topics that are highly current and relevant to the healthcare institutions, healthcare workers, and various spheres of business. We will go through the Bill of Rights, we will discuss the issue on concentrated debate on the impact of COVID-19 pandemic on human rights and the effect on healthcare workers versus the rights of patients in South Africa, and the global positioning of mandatory vaccines in the eyes of human rights. I think from there I'll give it to Ravana to continue with the conversation.
Thank you, Dr. Gila. Ravana, can you tell us more then about South Africa's response to the pandemic?
Thank you. So following the first reports of the SARS-CoV-2 virus in December 2019, the COVID-19 pandemic has had a drastic impact on how societies function globally. Many countries introduced stringent public health interventions such as quarantines, travel restrictions, national lockdowns to try and contain the spread of the virus. However, government action and their efficacy in responding to the pandemic have varied considerably, particularly in the light of information about the virus and the drastically changing epidemiological and data landscape. In this context, evaluating the impact of public health responses and determining whether the human rights limitations that accompany them were justified has really been challenging. On the 15th of March 2020, just 10 days after the country's first case of COVID-19 was diagnosed, the government announced its plan to implement a national lockdown under powers provided by the Disaster Management Act 57 of 2002. The regulations promulgated under this act provided for the adoption of expansion of public health measures during the course of the lockdown. They include the prohibition of public gatherings, the suspension of most economic activities other than essential services, the introduction of mandatory testing with compulsory isolation and quarantine for those who tested positive or have been in contact with persons that have tested positive. In terms of Regulation 11.2 of the aforementioned Act, they make provision for the imposition of a fine or at least 6 months of imprisonment of a violation of the Disaster Management Act. The government's response to the pandemic was couched almost entirely on the Disaster Management Act. The government's decision to utilize this act rather than declaring a state of emergency in terms of the Constitution meant, importantly, that constitutional human rights were not suspended entirely during the state of disaster due to the fact that a state of emergency will result in a suspension of all human rights, which is actually quite harsh on citizens, as citizens will lose all protection of their human rights. Consequently, limitations of these rights resulting from COVID-19 pandemic needed to be justified in terms of what we call the limitations clause of our Constitution, which is in Section 36. So basically, Section 36 of the Constitution states that all limitations need to be reasonable and justifiable in an open and democratic society based on human dignity, equality, and freedom. So basically, that's how we go about doing our limitations on human rights, as they are not absolute. So the terrain of the content of over the implication of human rights of public health responses has been fraught with complexity and uncertainty that has evolved over time and develops further with each human rights crisis. Just as the HIV epidemic significantly shaped the relationship between public health and human rights during most of the last 4 decades, it is likely that COVID-19 is definitely going to be the pandemic that's going to become crucial in defining the role of human rights in modern day infection control. Thank you.
Thank you very much, Ravana. Nitin, it's clear that the COVID-19 pandemic has also profoundly affected South Africans' constitutionally recognized human rights. Can you tell our viewers more about these affected human rights?
Well, if you start off from the beginning of our hard lockdown, which was introduced under the Disaster Management Act, which established a national state of disaster, it imposed a very severe restrictions of movement, the consumption and sale of alcohol and tobacco, and criminalized unlawful conduct for disobeying those restrictions. In those early months, there was a lot that we still did not know about the infectiousness and the modes of transmission of COVID-19. But also, there was a willingness of people to allow limitations on the human rights in the interest of public health and greater good. This lockdown was considered proportionate at the time. There was a trust in government, and people knew that their rights were being limited, but they accepted those limitations. In the early days, a few attempts The few attempts to challenge the limitations legally through court cases were not successful because it was believed that the government was acting in the best interests and acting within the bounds of the Constitution. However, the national lockdown resulted in many human rights violations, which were identified subsequently. The most affected constitutionally recognized rights were those of freedom of movement, assembly, trade, dignity, life, access to healthcare, equality, women's and children's human rights, prisoners, and rights to socioeconomic rights. I will go through some of these during this discourse. People during the time were subjected to severe limitations, and for that purpose, the police and the South African National Defence Force were called upon. People have questioned the deployment of the South African National Defence Force to affected communities. There have been significant number of cases reported of police and army brutality, including deaths. As you would know and well publicized, a successful legal challenge was brought against the South African National Defence Force concerning the murder of Collins Khoza by members of the South African National Defence Force in the townships of Alexandra. On May 15th, 2020, in a detailed and far-reaching judgment, the court made it clear that members of the security forces must respect and protect human rights and dignity to life, not commit torture, and only resort to minimum force to enforce the law. The South African Defence Force was subsequently instructed to publicize the court order, investigate the deaths properly, warn its members against criminality, and develop a code of conduct in giving effect to the state of disaster. When one looks at other aspects of the rights that were limited, unfortunately, South Africa has not respected its legal obligations either in terms of constitutional or international law towards millions of people who are asylum seekers, refugees, and undocumented migrants. People without South African identity document or permanent residence did not qualify for various forms of social relief in the form of support to small and informal businesses, a special COVID relief or distress grant, a topped-up child support grant that was introduced in April 2020. This too was subjected to legal challenges. How did the lockdown impact on women and girls? The lockdown had a negative impact on women and girls. The state's response to COVID-19 at times was found wanting and at times interrupted or completely shut down health services for women. This included access to contraception, maternal health care, HIV-related services, and abortion. The pandemic also disrupted services for the survivors of gender-based violence. The implementation of the stay-at-home restrictions or lockdown led to an increase in violence against women and girls and to a surge in various forms of sexual and gender-based violence, including intimate partner violence. Due to the state's regulations, more women and girls were trapped in abusive environment. And it's well known now in numerous publications on the twin pandemic that coexist with the COVID pandemic, which is gender-based violence, which is not necessarily only in South Africa, this is throughout the world. If one looks at the other group of individuals that were affected were the healthcare workers whose rights were violated, but I will be discussing this in more detail soon. In another group that was particularly vulnerable during the COVID-19 pandemic is the prisoners, and Inspecting Judge Cameron of the Correctional Services and the Detention Justice Forum called on the government to release certain categories of prisoners. As a result, in early May, President announced the early parole of certain categories of prisoners, leading to the release of 19,000 inmates. When one looks at other groups, especially the elderly, the poor, the women and children, led to violations of human rights to equality and dignity as well. So when one looks back and trying to evaluate whether the constitutional response was appropriate, we have to take into account two factors. Firstly, was the drastic lockdown measures achieving the public expectations, as the drastic limitations of rights did not contain the COVID-19 pandemic, because the records kept by the Medical Research Council of all deaths and what they describe as excess deaths was above the annual average. And secondly, It's clear that violations of human rights outweigh the limitations of human rights, that the measures taken have impacted profoundly negatively on constitutionally enshrined socioeconomic rights to basic education, access to healthcare services, and sufficient food. And by impacting profoundly on socioeconomic rights, they've also impacted on fundamental human rights such as people's rights to dignity and right to autonomy. So, the aim was to limit the human rights on the right to freedom of movement with the intention that it will stop the spread of the virus, but this limitation results in a negative impact on other human rights, and despite this, South Africa went into early lockdown, but the virus was not contained as an actual rise and death during the lockdown was actually massive. Thank you.
Thank you very much, Nitin. It's clear that one thing that comes through is that human rights need to be respected regardless of the situation or the extent of the pandemic in this case. Ravana, you mentioned Section 36 of the Constitution. Has South Africa's response to the COVID-19 pandemic met constitutional criteria when applying Section 36 of our Constitution to limit human rights to contain a pandemic?
Thank you, Navisha. So the argument that I'm just going to put forth now is something very different from the train of thought that is actually occurring in South Africa and around the world. It's just something that is basically like a light bulb moment that I would like to put forth, contrary to the trend of thought of South Africa at the time of lockdowns. So if we think out of the box and we find that governments and advisors' only understanding was that we need to limit human rights and that it was highly necessary to do these kind of limitations. However, when you look at it conversely, you have expanding of human rights during an epidemic, which may be a means of epidemic control. So I'm just going to speak about the difference between the limiting of human rights and the expanding of human rights. So I think that there is still not the appreciation for the expansion of human rights, and this is something that we basically learned from the HIV epidemic. So we learned that not by assumption, but by reflecting on a massive global virus that is HIV, and we can compare the response of governments to HIV to determine if the response has met constitutional criteria with COVID-19 when applying Section 36 of our Constitution to limit human rights to contain the pandemic. So though it may seem quite different or difficult from the HIV pandemic, it seems to be the same principle at play. What Judge Michael Kirby once termed the AIDS paradox was developed to say that people living with HIV are facing discrimination in access to healthcare services and access to schools. They face stigma and the threat of criminalization of HIV transmission. So, however, if we protect these people instead of marginalizing them, we make it easier to prevent, to be open about the epidemic, to promote HIV testing and disclosure. So by protecting the rights of people with HIV, we in fact protect the rights of people who don't have HIV. So if we protect infected persons' human rights, instead of marginalizing them, we make it easier to prevent and be open about the epidemic. This underlying principle can be applied and adapted to COVID-19. So let's just say that there's much higher risk of COVID-19 transmission among congregate or overcrowded communities, where there is a denial of fundamental socio-economic rights, which are recognized in our constitution, such as food, water, housing. If it had been accepted that a significant economic cost could be incurred to actually fulfill or realize human rights at that moment, because it would increase autonomy and the ability to follow public health messages around hygiene and social distancing, then we would have put people in a better position to avoid being infected and to avoid infecting other people. So a great deal of expense, like tens of billions of rands, was incurred on limiting human rights during our lockdowns. If this was the case, why could we not consider a greater expense in realizing human rights, particularly if it meant that it would have been a more effective means to control the pandemic itself? So based on, I would say, jurisprudence developed around the HIV epidemic became a touchstone for a human rights approach. And if we look at the human rights-based approach to the epidemic, it played a significant role in concretizing the role of human rights in public health responses globally. So in the treatment action campaign case, which was basically a landmark judgment, which I'm sure a lot of people have come across, the court basically recognized both the severity of the HIV epidemic as well as government's competing duties to realize socioeconomic rights. So what the court went on to say was, they went on to say that we are also conscious of the daunting problems confronting governments as a result of the pandemic. And besides the pandemic, the state faces huge demands in relation to access to education, land, housing, food, water, social security. These are the socioeconomic rights entrenched in the Constitution, and the state is obliged to take reasonable legislative and other measures within its available resources to achieve progression of these rights. Therefore, it is significant from the HIV epidemic to note that it may have a greater impact if human rights were in fact realized instead of being restricted to achieve a more positive and successful public health response in respect of keeping a pandemic under control. Thank you.
Thank you very much, Ravana. So, very interesting concept in limiting versus expanding human rights is the thing to keep in mind, viewers. There's a few comments coming through the chat, which will probably address as we go along. Bethuel asked, as per one's rights, according to your legal expertise, must it be enforcement to want to take a vaccine? And I'm sure we're going to be addressing this in a short while, Bethuel. So thank you for that. I think another contentious issue was the impact of the COVID-19 pandemic on the human rights of healthcare workers versus the human rights of patients in South Africa. Ravana, in this regard, what are the human rights of patients in accessing healthcare in South Africa in relation to the COVID-19 pandemic?
So basically, I have a mouthful to say because it's a lot of legislation that I'm going to be discussing, and it's going to be pertaining to doctors, nurses, healthcare, employers, and everyone at hand. So it appears that some health professionals, such as doctors and nurses employed in health establishments and registered with their professional bodies, were refusing to treat COVID-19, and obviously maybe not intentionally, because I know the fear of the virus was quite extreme at the time. And even when they have been provided with the necessary PPE, I think the fear still prevails. So in order to advise employees on whether such conduct is unethical or illegal, it's necessary to consider the provisions of various relevant healthcare legislation, and I'm going to be discussing them piece by piece. So the piece of legislation that I'm going to start with is the World Medical Association, that's the WMA International Code of Ethics. So basically, in terms of this code, a physician shall be dedicated to providing competent medical services in full professional and moral independence with compassion and respect for dignity, which is a human right. So doctors who refuse to treat patients for no good reason will not be providing a competent medical service and will not be acting with compassion and respect for dignity. So their failure to treat COVID-19 patients when they have been provided with the necessary PPE is a clear violation of the WMA International Code of Ethics. Moving on to the ICN, which is the International Council of Nursing. So in terms of this code, nursing is respectful of and unrestricted by consideration of age, creed, culture, disability, illness, gender, sexual orientation, nationality, politics, race, and social statuses. So nurses should not discriminate against patients on account of their illness, which would also be classified in terms of COVID-19. So the code goes on to state that nurses should advocate for equity and social justice in resource allocation, access to healthcare and other social services, and economic services as well. So by refusing to treat COVID-19 patients, nurses would be denying them their fundamental rights to access to healthcare. Going on to the Hdcsa, which is very popular. So the Hdcsa Professional Rules of Conduct is very similar to the WMA Code of Medical Ethics. So basically, the Hdcsa Rules of Professional Conduct focuses on respect for the dignity of a patient. Now, we all know that the right to dignity is considered as an absolute right. So they also state, however, that a practitioner shall at all times act in the best interest of his or her patients, respect patient confidentiality, and we all know that the POPI Act has come in respect of that as well, their privacy, choice, and dignity, and maintain the highest standard of personal conduct and integrity in terms of Rule 27A of the HDCSA rules. So it cannot be said that the health practitioners who refuse to treat COVID-19 patients despite being provided with the requisite PPE are respecting the dignity of such patients, nor are they acting in the best interest of such patients or maintaining the highest standard of personal conduct and integrity. Their refusal to treat patients under these circumstances could be regarded as evidence of improper or disgraceful conduct and in any HPCSA disciplinary hearing against them. So the HPCSA General Ethical Guidelines for Healthcare Professions amplify the HPCSA's professional rules. So health practitioners with adequate PPE who refuse to treat COVID-19 patients are not regarding the best interest and well-being of their patients as their primary professional duty. They also may not justify refusing to treat such patients because they may be putting their own lives at risk, which is what I spoke about earlier, the fear of treating. So especially as they have been provided with necessary PPE, so in those circumstances it will be unacceptable. Instead of guarding against human rights violations of patients, they would actually be participating in them and preventing and not promoting their fundamental right of access to healthcare once again. So all these violations would add weight to evidence against them in any charge by the HPCSA of improper and disgraceful conduct. The HPCSA goes on further to say that although it may be ethically justifiable for the health practitioner to refuse to treat COVID-19 patients, as obviously as a last resort, where they are not provided with the required PPE, so in those circumstances, it would be justified. However, in terms of the guidelines, such a refusal to treat imposes a duty on employers themselves or fellow health practitioner employees, if they are registered with the HPCSA, to report conduct of delinquent practitioners. So this will apply to a fellow colleague who obviously is who you are aware of that has been provided with PPE but is refusing to treat such patients. Now I go on to the SANC, which is the South African Council of Nursing. So a refusal to treat COVID-19 patients without good reason clearly violates the ethical duty of nurses, not willfully or negligently omit to treat or care for such patients within the scope of their practice, and could result in disciplinary procedures against them. It is also a disciplinary offense willfully and negligently to fail to maintain the health care of practitioners by not providing specific care and treatment for the very ill, as in the case with hospitalized COVID-19 patients. So in both instances, the nurse concerned may be found guilty of improper or unprofessional conduct. And finally on this, I'm going to speak about the Constitution itself. So the South African Constitution basically provides that everyone has the right to access to health care in terms of Section 27(1), and children have the right to basic health care in terms of Section 28(1)(c). It also provides that nobody should be unfairly discriminated against in terms of Section 9(3), and no one should be refused emergency medical treatment in terms of Section 27(3). So a refusal by a healthcare practitioner to treat COVID-19 patients, despite being provided with a requisite PPE, would be a denial of the patient's right to access to healthcare, and in the case of children, to basic healthcare. It will also be a violation of the patient's right not to be unfairly discriminated against if the refusal to be treated by the health practitioner is because the patient merely just has COVID-19. So whereas some COVID-19 patients require emergency medical treatment such as ICU or ventilation, such a refusal to treat them would be a further violation of the Constitution. So in addition, such health practitioners may not use the common law defense of necessity, which is what I described earlier, as a reason to refuse to treat COVID-19 patients, because it would not be, in terms of Section 36 of the Constitution, which is the limitations clause, it will not be reasonable and justifiable to deny such patients their constitutional rights of access to healthcare, especially in the instance where PPE has been provided. So it will also violate the constitutional rights of patients not to be unfairly discriminated. Thank you.
Thank you very much, Ravana, for that very in-depth description of what we're allowed and not allowed to do according to legislature. I think for all of the healthcare colleagues on the call, we have to be advocates for our patients, but each and every one of us at some point in the pandemic felt that we had our rights trampled upon. And especially when times of substandard PPE provision and refusal to treat patients with substandard PPE, putting ourselves and our families at risk. It was a very difficult decision to make when healthcare practitioners had to refuse to treat patients in need. Nathan, this brings me to my next question, and that is, does the human rights of healthcare workers prevail over a patient's right to access healthcare in COVID-19 settings in South Africa?
Thank you, Nivisha. Yes, it was very challenging times during the last 2 years. And the response to your question is yes. But is there a legal protection against life-threatening infections for frontline healthcare practitioners? What does the current relevant legislation say? The South African Constitution clearly states that everyone has a right to an environment that is not harmful to their health and well-being. That's Section 24A. And everyone has a right to fair labor practices. Also, the Occupational Health and Safety Act of 1993 says that every employer shall provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to health of the employees. And the National Health Act says imposes an obligation on the health establishments to implement measures to minimize injury or damage to the person and property of healthcare personnel working in the establishment and to reduce disease transmission. Ivana alluded to the doctrine of necessity. To briefly explain it, the doctrine states that necessity applies when people are placed in a situation of danger and the law allows them to protect their interests by violating the rights of innocent third parties. This is based on the principle that the legal convictions of the community recognize that people's own lives are considered more important than the lives of others. The Constitution clearly recognizes that while everyone has the right to access to health care, Section 27(1), such right may be limited if it is reasonable and justifiable to do so. So, in circumstances in which healthcare workers are exposed to a life-threatening disease such as COVID-19 because of a lack of PPE or working environment that does not conform to the current regulations, and also the WHO recommendations for dealing with shortages of such equipment and PPE, the courts may well hold that it's reasonable and justifiable for healthcare workers to withhold their labor after unsuccessful attempts to advocate for the provision of such PPEs or safe working environment. So, if a healthcare practitioner fails to assist or in the management of a patient with COVID, or if the healthcare practitioners are not provided with adequate PPEs, what are the legal consequences of such cases? The COVID-19 regulations imposes numerous duties on the general public and healthcare providers, but imposes no direct duty on healthcare providers and healthcare establishments to provide PPEs for the employees. However, the regulations do state that any person who intentionally exposes another person to COVID-19 may be prosecuted for an offense including assault, attempted murder, or murder. It could also be argued, therefore, that if the healthcare providers or healthcare establishments that do not provide PPEs for healthcare workers who are exposed to COVID-19 because of the lack of such PPE, or provide a working environment that does not follow the current recommendations for dealing with shortages or such equipment, such conduct amounts to intentional exposure of healthcare workers to COVID-19 infection. In addition to being a crime in terms of the COVID-19 regulation, a failure of the providing PPEs for healthcare practitioners in such circumstances may also be an offense in terms of the Occupational Disease and Safety Act. Furthermore, in terms of compensation for Occupational Injuries and Disease Act of 1993, where such failure to provide PPEs results in healthcare workers contracting COVID-19 or dying from COVID-19 whilst working, such workers or their dependents may claim compensation from the compensation fund. So, at the end of this, and we see a patient, how does it impact on the patient and how does it impact on the doctor? In the light of the above, under the common law, if a if a COVID-19 patient dies as a last resort, health practitioners have refused to work after the attempts to persuade the relevant health establishments to provide PPEs that have been ignored. It is the health establishments and not the health practitioners who may be found guilty of culpable homicide. The practitioners may raise the defense of necessity. As the health establishments were in control of a dangerous situation, they may be found guilty of culpable homicide because they had a legal duty to prevent harm to COVID-19 patients by providing health practitioners dealing with them with the necessary PPEs. This is a complex and emotive issue, I'm sure, that we were faced with during the pandemic at numerous stages of the pandemic related to the use of PPEs, and I hope it clarifies some of the protections afforded to the healthcare practitioners. Thank you.
Thank you very much, Nitin. So there you have it, audience. It's not only important to know your rights, but also acknowledge how these rights are being imposed upon us, especially during practice and during times of difficulty, such as this COVID-19 pandemic. That brings me to the next point. So guests, please participate in the poll that's being posted in the chat. We would really like to hear your opinion on whether, firstly, the restrictions imposed by the COVID-19 pandemic response violate the rights of an individual, and secondly, vaccine mandates, are they necessary in the workplace? And you'll find this poll in the chat. No one should get sick and die just because they cannot access the health services they need. And what's coming through this talk so far is that ethical principles dictate that limited life-saving resources should be allocated fairly. What began as a desperation to achieve population immunity has evolved into a debate on mandatory COVID-19 vaccinations. Furthermore, human rights are fundamentally linked to global health in the context of COVID-19. So this brings us to the next section, which is the global position on mandatory COVID-19 vaccines in the eyes of human rights. Nitin, can I please ask you, in terms of mandatory vaccines, what is the international position from a human rights perspective?
Thank you, Navisha. I think this is a very complex and interesting matter, and it's not as simple as just saying that we need to mandate vaccines, and it requires in-depth knowledge and some knowledge of the current international human rights laws and regarding mandatory vaccinations. Firstly, I'll go through some of them, but not in detail, just to give you some idea what laws and regulations have been adopted internationally. If the first and the foremost principle is the Nuremberg Code, which came about after the Second World War, is that the voluntary consent of human subjects is absolutely essential. Then Article 7 of the legally binding International Covenant of the Civil and Political Rights that was ratified by 173 governments worldwide clearly dictates that no one shall be subjected without his free consent to medical or scientific experimentation. Article 3 of the United Nations Education, Scientific and Cultural Organization, or UNESCO, the Universal Declaration on Bioethics and Human Rights determines that human dignity, human rights, and fundamental freedoms are to be fully respected, and the interests and welfare of the individuals should have priority over the sole interests of science or society, while Article 6 clearly states that any preventative, diagnostic, and therapeutic medical intervention is only to be carried out with the prior, free, informed consent of the person concerned, based on adequate information. Whilst the UNESCO Declaration does not establish enforceable rights, it is persuasive concerning that the global standard for informed consent should be. In terms of Article 5 of the Radio Convention, which is the Convention for the Protection of Human Rights and Dignity of Human Beings regarding the application of biology and medicine, specifically determines that an intervention in health field may only be carried out after a person concerned has given free and informed consent to it. This person shall beforehand be given appropriate information as to the purpose and nature of the intervention, as well as to the consequences and risks. The person concerned may freely withdraw consent at any time. Although the Oviedo Convention is only legally binding to the European Union states that ratify the convention, it clearly sets out the standards regarding protection of human rights in the biomedical field. And the organization that we all know in terms of the WHO guidance for managing ethical issues in infectious disease outbreaks, the bioethical foundation for the support of emergency use of medical intervention is only justified by the ethical principle of respect for patient autonomy. In other words, the right of individuals to make their own risk-benefit assessments in the light of the personal values, goals, and health conditions. So when we discuss the limitation of fundamental human rights, one needs to ask, how do governments or health authorities make decisions to impose vaccine mandates? Firstly, and most importantly, one needs to understand that vaccine mandates needs to pass what's called the necessity stage of the proportionality analysis, which I'll go through in due course. Fundamental human rights and freedoms are not absolute. Their boundaries are set by the rights of others and the legitimate needs of society. Generally, it is recognized that the public health justifies the imposition of restrictions on exercise of fundamental rights, subject to such restrictions being reasonable and proportionate. In order to determine whether the government may impose vaccine mandates, the proportionality analysis, which is a standard legal test for adjudicating human rights disputes, needs to be applied to determine whether it is legitimate, whether it's inadequate, whether it's necessity, and the proportionality of such restrictions on human rights. So, the proportionality test consists of 4 main stages in determining whether the measure pursues a legitimate purpose. It is legitimate aim of the state parties to take action to protect the public against infectious disease, according to the United Nations Economic and Social Council and the Hdcsa principles on the limitation and derogation of provisions in the International Covenant of the Civil and Political Rights. There must be clear that this measure must be adequate in nature to achieve its purpose, and that's adequacy. According to the WHO and the US Centers for Disease Control, fully vaccinated people still need to social distance and adhere to a number of COVID-19 preventative measures, given the uncertainty with regards to whether the COVID-19 vaccines would be effective against other variants. Secondly, whether the COVID-19 vaccines would provide a long-term immunity. As we know, the vaccine efficacies are based on short-term data currently. And thirdly, whether the COVID vaccines would prevent people who had received the vaccine from spreading the virus. Currently, there seems to be no consensus that mass mandatory vaccinations would achieve the desired outcome of achieving herd immunity and returning society to normality, and as such, the measure cannot be deemed adequate. So, when one looks at the next criteria, which is the necessity stage, the measure should not infringe on human rights no more than absolutely necessary to accomplish that purpose. In other words, an alternative to mass mandatory vaccinations would be only to vaccinate those vulnerable groups after they have given their informed consent and people that choose to be vaccinated. Given that various alternatives to vaccine mandates would not pass the necessity stage of the proportionality analysis. And lastly, the measure should not have a disproportionately adverse effect. The legislative measure must represent a net gain when the reduction in enjoyment of rights is weighed against the benefits achieved by the infringing measure. Vaccine mandates cannot result in a net gain, as it will effectively discriminate against and deny approximately 30 to 40% of the world's population that do not want to be vaccinated with what's regarded as an experimental COVID-19 vaccine, and give up their most basic human rights to life, liberty, freedom of movement, and education in order to combat a disease with a population level crude mortality rate up to 0.5%. So, given the mandatory vaccination measures would fail the adequacy, necessity, and proportionality stages, mandatory vaccinations per se would be disproportionate and therefore be unlawful. Importantly, Article 4 of the International Covenant of Civil and Political Rights and the Hdcsa principle specifically determines that no state, including those that are not parties to the covenant, may suspend or violate, even in times of public emergency, the freedom and perform any medical or scientific experimentation without free consent. So, when one looks at international human rights, it affords The laws afford the individual a right to make informed choices about vaccination and all medical interventions. The underlying principle is that those who undergo risk of medical treatment should make the final decision about their own participation after they have informed of the purpose, risks, and benefits of the treatment. And the COVID-19 vaccines are considered experimental based on the fact of the emergency use, and the citizens have a right to refuse such a vaccine. So governments should comply with the international human rights laws and make COVID-19 vaccinations voluntary and not mandatory. There should also not be discrimination against those who choose not to be vaccinated, like those not being allowed to travel, attend schools, shop, and attend social gatherings, or not being employed. So how do we crystallize what I've just said into practicality? And looking at mandatory vaccines, that should be considered alongside, all mandatory vaccines should be considered alongside all relevant scientific, medical, and legal and practical considerations. It should achieve the necessity and proportionality stages and should be considered for and proportionate to the achievement of an important public health goal, including socioeconomic goals. The public health goals, which include herd immunity, protecting the most vulnerable, protecting the capacity of acute healthcare system. It must be identified by a legitimate public health authority with less coercive or intrusive policy intervention. If this is not achieved, then the mandate will not be ethically justified, as it would result in restriction of individual liberty and autonomy. Individual liberties should not be challenged for longer than necessary, and all mandates need to be reevaluated that it remains necessary and proportionate to achieve a public health goals. In addition, the necessity of the mandates to achieve the public health goals should be evaluated in the context of the possibility of repeated vaccination, which is currently the case as the virus evolves, as this may challenge the possibility of mandates to realistically achieve the intended public health objectives. Then one should also look at the sufficient evidence of vaccine safety. Data should be available to demonstrating the vaccine safety in the population for whom it's intended. Policymakers should consider whether the vaccines being mandated for emergency use or conditional use meets the evidentiary threshold for safety sufficient for the mandate. And also, there should be sufficient evidence of vaccine efficacy and effectiveness. Vaccines should be efficacious in the population for whom the vaccination is mandated to achieve public health goals. For example, if the vaccine mandate is considered necessary, there should be sufficient evidence that the vaccine is efficacious in preventing serious infection and/or transmission, or to prevent hospitalization and to protect capacity of the acute healthcare system by reducing hospitalization. What part and parcel about any vaccine mandate there should be adequate supply of the vaccine. And most importantly, that's often forgotten and neglected. How impactful and how important is public trust in this whole process? Policymakers should consider the effect that mandating vaccination could have on public confidence and trust, and particularly in trust in scientific community and public trust in the vaccination in generally. If the mandate threatens to undermine the confidence and public trust, it might affect the vaccine uptake and adherence to other important public health initiatives. Coercive powers of governments or institutions display undermines the voluntariness that could have an unintended negative impact and consequence for the vulnerable and marginalized population. So, what needs to be done, high priority should therefore be given to threats to public trust and confidence amongst the historically disadvantaged minority populations, ensuring that crucial considerations are taken into account. Vaccine hesitancy, which is currently the case, may be stronger in such populations that may not be restricted to concerns of safety and efficacy, as mistrust in authorities may be rooted in histories of unethical medical and public health policies and practices, as well as structural inequity. Such vaccination mandates are regarded as another form of inequity or oppression, making it more difficult to access jobs and essential services. And with any issue related to public trust, there needs to be an avenue for conscientious objection that must be subject to strict scientific and prudential limits to its appeals. There should always be ethical process in decision making. So, in terms of currently the advocacy of vaccine mandates, as we know, vaccines are effective in treating patients with COVID and preventing severe illness and reducing hospitalizations. Ethical considerations and caveats should be explicitly discussed and addressed through an ethical analysis. Decisions about mandatory vaccines should be supported by the best available evidence and should only be made by legitimate public health authorities in a manner which is, the operative word, transparent, fair, and non-discriminatory, and involves the input of affected parties. And I think understanding these concepts and hopefully crystallizing the discussion will hopefully give the audience a different insight on how vaccines should be mandated and how we should approach vaccine mandates in currently in our country and in the workplace. Thank you.
Thank you, Nitin. I think despite those detailed descriptions of vaccine mandates in the global sphere, there's been a general worldwide unhappiness in the way that vaccine mandates have been implemented, regardless of whether or not there's been adequate supply and regardless of the populations being influenced to take these vaccines. And similar things coming through our chats as well. We have a participant that's mentioning why must we be told to take a booster? What's the logic behind this? And it goes back to what you started to say about the mandates. I want to bring this home now with Ravana and ask her exactly with regards to mandatory vaccines again. What is the South African position from a human rights perspective on this issue?
Thank you very much. I'm sure this is going to be of huge interest, and I have so much to say on this. So basically, finally for this afternoon, we're going to discuss the constitutional rights in South Africa that protect against mandatory COVID-19 vaccines, together with legislation that actually provides legitimacy for mandatory COVID-19 vaccines in very limited specific circumstances. So we assess this question in the light of constitutional rights and ethos enshrined in the Constitution of South Africa. So that's where we're going to begin. So the Constitution basically comprises of a right in terms of Section 12, which is the right to freedom and security of a person. And I'm going to speak about Section 12.2. So a plain reading of Section 12.2 of the Constitution makes it evident that every person has the preponderant right to make decisions on health and medical intervention and treatment, which undoubtedly includes the acceptance or rejection of a vaccine. So, however, constitutional rights are never one-dimensional, and rights may be limited when they are justifiable grounds for doing so. So the rights to bodily integrity and psychological integrity can thus be limited by legislation which passes the stringent test of being reasonable and justifiable, which are the requirements of Section 36, which we dwelled on earlier, and this will also be discussed. So the South African courts have not yet had the opportunity to decide on the issue of compulsory vaccinations, but it has made several other judicial announcements on Section 12 itself, which obviously will be used as precedent when deciding on vaccines. So in the precedent, I'm just going to mention a few. So in the precedent of the Minister of Safety and Security and another versus Covert, in this case, the court basically relied on the public interest and applied a balancing act of rights to conclude that the respondent was basically forced to undergo a surgery despite the fact that he had not consented. And this is highly unlikely in South African law to not take an informed consent to perform surgery. However, in this instance, the public health measure actually outweighs these individual rights. Then similarly, in another case of the Minister of Health of the province of the Western Cape versus Goliath and others, in this case, the court compelled surviving respondents to receive treatment for tuberculosis against their will, and this again was in public health interest. So their decisions show that in some instances, the public interest outweighs human rights to bodily integrity and psychological integrity of individuals. So basically, you call it a balancing of rights, where one, you put it onto a scale and one tips it over on the other. Although it may be true that vaccinating enough people will give you herd immunity, there is no guarantee or certainty about the effectiveness of the vaccine, its long-term effects on people, and whether social solidarity triumphs over individual or patient autonomy. So it is possible to contract COVID-19 after having received the vaccine, which we are all aware of. It is also important to point out the reality of your mask. So when we wear a mask, we can actually avoid contacting COVID-19 in the first place if we wear it properly and we wear the appropriate mask. However, we are all aware that if we are vaccinated, we would still have to wear a mask. So your vaccine does not give you full proof from contacting the virus. You will still get the virus. So in this instance, it's very important to, to point that out, as well as the waning effect of vaccines, which is the reason why, you mentioned the issue of a question on boosters. So based on this, there is a waning effect on vaccines. So that is the reason why boosters are being promoted. So in South Africa, we are well known for a culture, and I'm sure it's come across every platform of profession, which is the concept of Ubuntu. So in terms of this means that an individual should act in a manner which benefits the greater community, which we call the greater good. So mass vaccinations promotes the principles of Ubuntu because it not only protects individuals, but protects society at large. But then we can give the converse of the principle of Ubuntu and contradict that. So conversely, by refusing to be vaccinated, the long-term effects of vaccines are still unknown. And individuals will be able to exercise their rights under the Constitution, which also contributes to the concept of Ubuntu, where our Constitution undoubtedly respects and protects that a person's decision to receive a vaccine must always be voluntary and made without any undue influence. We are aware that COVID-19 is highly contagious and deadly, but there is not enough evidence to indicate that a compulsory vaccination approach countrywide or globally is absolutely necessary at this stage, as we are seeing in precedents across the world. So although the disease has inflicted death and hardships on the population, so does diabetes, so does HIV, AIDS, cancer, lung infections, TB, and many other illnesses. So although the government has said vaccines will not become mandatory in South Africa and that forcing someone to be vaccinated would be a clear violation of their Section 12 rights of the Constitution, the government can certainly change its stance in extreme circumstances. That is, if it comes to a point where public health becomes more important than individual autonomy and rights. So contrary to the decision of government to not impose COVID-19 mandates, vaccine mandates in South Africa, there is still a loophole, which I said we are going to discuss. So in terms of this loophole is actually the employment and labor practice sector, where compulsory immunization must be considered alongside employment legislation and regulations such as the Labor Relations Act, the Occupational Health and Safety Act, the Employment Equity Act, and the Basic Conditions of Employment Act, where employers may introduce mandate vaccine policies in the workplace, which some employees may reject. So in some circumstances, the rejection of mandatory vaccines in the workplace can constitute constructive dismissal. So workplace and employers will still be in a position to adopt policies in line with employment legislation and the Constitution to make vaccines mandatory for employees if such policies do not infringe on the Section 12 rights, which I mentioned, the right to bodily and psychological integrity. So the government, this is very, very current that I'm going to talk about now. The government has published a new set of code of practice, which is set to replace the existing COVID workplace rules in South Africa, where the state of disaster is expected to lift on the 15th of April 2022. So South Africa's Employment Tribunal has issued the first decision of COVID-19 vaccines. So basically in this instance, there was a case that came before the CCMA, and what had happened here was, it was the first decision, which was in January 2022 on the dismissal of an employee for refusing to get vaccinated against COVID-19. So an inquiry was convened by the employer in this respect, and where the employer went on to argue that the employer's decision to not get vaccinated basically incapacitated her. The CCMA issued an arbitration award concluding that the dismissal for incapacity was fair, as businesses have a statutory obligation to provide a safe and healthy working environment for all its employees. So basically, this person presented as a risk to other employees. So in short, the directions allowed and will continue to do so until the 15th of April 2022. That is, an employer to undertake a risk assessment, which I'm sure is currently going on in companies and various institutions, to determine whether it will make the vaccine of employees mandatory. The employer must therefore decide after its risk assessment and considering its operational requirements and working environment that it will not make a vaccine mandatory. So that is obviously left on a company or hospital or whatever it is, an institution basis. After the 15th of April 2022, the directions are expected to lapse along with the Disaster Management Act, and this will all cease. So the Department of Labor and Employment have issued a code of good practice on managing exposure of COVID-19 in the workplace under the Labor Relations Act, which I will very quickly go through. So the Code of Good Practice specifically and expressly provides for mandatory vaccines in the workplace. In terms of the mandatory vaccines policy, the Code of Good Practice basically replicates the requirements of the directions in that there is mandatory vaccine for any category of employees. So in this instance, if they are bringing it into the workplace, so these are the steps that an employer needs to take into account and needs to apply. So the employer will need to basically inform the employee of the need to vaccinate once the vaccine becomes available for the employee. It's also important for us to note that the Code of Good Practice that's going to kick in April still does not require the employer to obtain or pay for the vaccine, but it will reasonably be required for the employee to assist the employee to register for either private or public vaccination. The employer also needs to ensure that the employee is counseled on these issues and allow the employee to consult a health and safety representative, a work representative, or a trade union official. Going on further, the employer has to give administrative support for register for and access vaccine certificate portals. They also have to provide paid time off in order to allow the employee to go and receive the vaccination. They can also provide transport to vaccination sites. So whereas the directions allowed employees the right to refuse to be vaccinated on the basis of constitutional or medical grounds, the Code of Good Practice basically refers generally to an employee's refusal to be vaccinated, but only requires the employer to make such reasonable accommodation for such refusal, where the employee produces a medical certificate attesting to the employer that having contraindications for the vaccine, and the employer has to accept this, and they can actually send the employee for a private assessment for their own peace of mind. So, as such, it appears that the Code of Good Practice would be less generous to the employees if they appeal on a non-medical objection to the vaccination. So the Code of Good Practice also states that employers must now require employees to disclose their vaccine status and to produce vaccine certificates in the workplace. However, processing of information further than this will all have to be compliant with the POPI Act, which is the Protection of Personal Information Act. So it will have to comply with those requirements. Going on further, it is important to also take note that under the Code of Good Practice, mandatory vaccine policies will also live side by side with the usual measures such as social distancing, PPE measures, personal hygiene measures such as the wearing of masks, barriers, hand washing, sanitizing, and surface disinfectant. And finally, a further emphasis which appears from the Code of Good Practice is that every worker is obliged to comply with the employer's workplace plan, which can include mandatory vaccinations to ensure that employers do not breach their obligation to ensure that their workplaces are free of health and safety risks. Thank you.
Thank you, Mrs. Yusuf. Ladies and gentlemen, on that note, we have passed our hour limit for this webinar. And let's see what comes of the uplifting of the state of disaster anticipated in April this year. Rivana and Dr. Gila, thank you very much for such an insightful and thought-provoking conversation today. It's clear that experiences such as global pandemics alters our individual as well as collective appreciation and responses to the rights we possess. The right to health, including access to basic health care, has been recognized as a universal human right through a number of international agreements. Attempts to protect this ideal then have relied on states as the guarantor of rights and have subsequently ignored stateless individuals. From our poll, we can see that there's quite conflicting opinions in our audience here today. So the first opinion we wanted to see was whether or not the restrictions imposed by COVID-19 by the pandemic response violate the rights of an individual. A majority of our audience agreed. 30% disagreed, and a very few were unsure about that. And when we asked about vaccine mandates being necessary in the workplace, there was quite conflicting opinions there, where 47% agreed and 43% disagreed with that notion. To all our delegates, thank you for your attention and participation. Please follow us on social media platforms for Regent Business School, where we will be continuing this discussion and taking on detailed answers to all of your questions in the chat. For anyone interested, Regent Business School is the only private higher education institution in South Africa to offer the sector-specific MBA in healthcare management. And more information can be found at www.regent.ac.za. Many thanks again to our speakers, and a safe, restful Human Rights Day weekend to everyone. Take care.
Thank you very much for having us.
Thank you, Rebecca.
Bye, everyone.